The future of arthroscopy looks brighter after one local specialist developed a technique gaining the attention from several medical specialists. News 10's Danielle Johnson joins us in studio with details.
Sylvia, it's common to believe that when dealing with an ACL tear, you are less likely to get back to doing what you love to do. Well, one orthopedic specialist says he has groundbreaking evidence that proves otherwise. Evidence that took several years to be published. Athletic orthopedic specialist Judson Penton says his study to improve ACL procedures is the answer to helping patients, athletes to be specific.
As a knee surgeon and a sports doctor, we're always trying to get our patients back to doing what they want to do. I mean, that's our goal. That's what we love to do.
Penton says the study came after an article revealed smaller grafts in patients had a failure rate of over 30%.
It was at that point that I was like, well, what can I do different to decrease this failure rate in my patient, in patient populations?
His solution, adding what's called a sartorius tendon to a common 4-strand graft, significantly increasing the overall graft size and strength.
Generally speaking, you can't repair the ACL, which means you can't sew it back together. And so we have to take a graft, which means you have to form a new ACL from the body's tissue.
Penton says statistically female and younger athletes naturally have smaller grafts. Increasing the graft size increases the chances of returning back to the sport.
Size does matter, especially in that patient population, to get a bigger graft size so that those patients can return to doing what they want to do, or at least have a better chance of returning to do what they want to do.
Dr. Penton says there are 2 parts to the study, the actual procedure itself and at least 2 years of follow-up data. Danielle Johnson, KOFY News 10.